So one of the things we talk about, the development of palliative care, that it really needs to be based on robust evidence, and how do we gain the evidence without good research. So I've been very fortunate to be working with Professor Richard Harding over many, many years, and at King's College they developed the original palliative outcome scale, and about 8 or 9 years ago, with Richard, we adapted that to the African setting and validated it in Africa. And in South Africa, we've been using it practically both for audit and quality improvement programs in our hospice services, and also for research. So Richard asked me to speak at this conference on the practical use of patient-reported outcome measures. Well, we believe that we've impacted quality of care, so the quality of care and the actual outcomes for patients and families. We believe that we have been able to provide quite a strong evidence base for the effectiveness of palliative care, and so it's been a good tool to discuss with government the importance of palliative care, and to discuss with funders the value of investing in palliative care. So really interesting that it needs to be a research tool that's translated into the setting, that's context specific, but also done in a stepwise fashion, that we don't lose the actual robust nature of it as a research tool. And it's been important to look at the fact that we want to enhance the patient experience of care, and a lot of clinical outcomes are around morbidity and mortality is spoken about. One of the ladies in the session spoke about, the outcome for her work as an ophthalmologist in cataract surgery is whether the patient can read again. But the palliative outcome scale asks the patients what's important to you, and it was developed with patient input. So we look at pain, we look at symptoms, we look at the emotional impact of the illness, and we look at the spiritual impact of the illness. So very few scales look at a multidimensional scale. We have really valuable tools in the Edmonton Symptom Assessment tool and other quality of life tools, but they don't very much look at what is the patient experience. And I think that's the important thing with APCA-POS. So we use it in our hospices to evaluate their service, and we use it to assess a baseline, what is the condition of the patient at that baseline, and we use it in research to show that palliative care can improve the patient experience even if the patient's clinical condition is deteriorating and the patient is in fact expected to die. But we can still control pain and the symptoms and make sure that they feel spiritually at peace and that they are well cared for within their family and within the palliative care program. We also, one of the studies that I presented at this conference was a study that we did with TB patients. And tuberculosis is a big problem in South Africa. It's actually the highest mortality rate is for TB, and it's a curable condition. So people think you don't need palliative care if you've got a curable condition. But in fact, this research showed that when we were assessing both patients with drug-susceptible TB that should be cured and drug-resistant TB that is more difficult to cure but can be cured, the people with the drug-susceptible TB had the biggest number of problems, and clearly those are also people who die. So we were able to prove to our government that people with TB also have palliative care needs. So there's a very strong palliative care program in our TB control measures as well in South Africa. So it just underlines the fact that research and evidence is useful in changing policy, influencing policy, and making sure that we have the patient at the heart of what we do. So to implement something like this, I would suggest that they go first to the King's College website and register as a user of the POS, the palliative outcome scale, then it would also be a good idea to engage with somebody who has used it as a kind of a buddy system to advise on how to use it. But there are ways that this outcome scale can be used to improve patient care, and there have been new versions that have been developed, and there have also been a couple of countries have developed an app to use that then the patient can complete the questionnaire themselves and send it in to kind of guide the discussion when they're next with their doctor. So it's been a very interesting journey using this palliative outcome scale.